Facial aging is a fairly complex issue. As we start to see changes throughout the face and neck area, we need to understand that there's a lot of moving parts that may influence what we're seeing. Historically, we've thought about things falling. In other words, soft tissue drops relative to our underlying bony anatomy. And while there may be some truth to this, it's not the entire story. I was involved in some studies 20 years ago about bony resorption and bone remodeling. This is an important part of the aging process. And we see this with patients with dentures and how that impacts, the aging process. But it's not the only answer. We also know that we lose volume as we age. In other words, if we were to do a quantitative analysis of how much stubborn fatty tissue or soft tissue volume we have throughout many of these areas or compartments of the face, it will decrease over time. With some of the muscle stimulating treatments that exist, such as TriLift, we talk about a loss of muscle volume over time. And in fact, decade after decade, over the age of 40, we're losing muscle mass at a very real and quantitative rate. We also know that with the aging process, we're losing collagen and elastin, and this influences the overall structural integrity of the skin, causing fine lines and wrinkles, and causing further loss relative to that structural integrity. It's important that we address all of these issues. So a deep plane facelift at Hanz Aesthetic Plastic Surgery is not only about cheek, chin, neck at those deeper tissue levels, but it's also about volume restoration. We take fat in the way of a fat transfer, and we're able to place that into things like the deep malar fat compartments, the nasolabial folds, pre-jowl sulcus, temples, in order to shape and really restore that youthful look. I would encourage you as a patient to look at a photo of yourself in your 30s and 40s and how that compares with those photos at age 50, 60. We certainly are losing volume, and we need to understand that a fuller face is a more youthful face. At the same time, we're doing other things with that deep plane facelift to provide comprehensive solutions. I'm a big proponent of CO2 resurfacing. What this is a way to improve the skin, not just from an architectural standpoint, but from the surface of the skin itself. In other words, if we have a tired, leathery appearance to the skin and we simply reposition that, we're going to be looking at repositioned, tired, leathery skin. We want to do reconditioning, which in this case uses a fractionated CO2 laser to help take away the fine lines, wrinkles, and provide a more youthful skin. Think of it as really kind of restoring the paint along with the architecture. So we may do some things that remodel when we're looking at doing some updates on our house, but we may also do some things with paint. That's what the laser brings to the table. So laser resurfacing, fat injections, along with the deep plane facelift, provide those comprehensive solutions to the aging process. Dr. Kevin Hanz, a board-certified plastic surgeon in Dallas, Texas. I've been in the aesthetic space for approximately 20 years. Board certified over the last 15, we find our private practice location at the southern tip of Highland Park, where Highland Park meets that uptown corridor, conveniently located with a number of exciting, innovative technologies available to you as a patient here at Hanz Aesthetic Plastic Surgery. We encourage you, if these issues resonate with you, to reach out. The office can be reached at 214-908-3633. We're happy to set up an initial consultation and meet with you in the very near future.